Hi, everybody. Happy Tuesday. It's Dr. Christine Anderson here, or Dr. Chris as my patients call me. And we've been running down the spine. We've run down all the extremities. Now I'm kind of coming back and talking about different joints in the body. So if you missed any of the other shows on posture, the spine, extremities, go back and watch them, especially if you have issues. This is actually something that's been sort of apparent in my life recently. So I have been getting orthodontia work done using an Alpha appliance, and just recently this right jaw has started sort of clicking, popping, and sticking. And this has not usually been an issue, but we've been shifting things around with my jaw and my teeth, which used to crowd and now they don't. So things are moving and changing, but I don't like this. So I was like, you know what? I really need to talk about this. So just because I'm a chiropractor does not mean I am immune to these issues and problems that people have. I just have a little bit more knowledge and means for understanding this. So I still have to do all the work, guys. I am, I'm not exempt from this. So I just want to share a little bit about the jaw here. Okay, so this is a mandible. This is the temporal bone right here of the skull. And that is why it's called the Temporal Mandibular Joint, TMJ. That's what people say. They go, I have TMJ. I go, yes, you do, because everybody has TMJ. But what I know what they're meaning. It's just one of those things, like a little joke. But this joint is actually a pretty sophisticated joint. So it actually has two motions to it. It has a gliding motion and then it has a hinging motion. So first this joint has to glide to the front part and then it hinges to open. And this little bone here, which is actually part of the cheekbone, stops it from going too far forward. So there's these checks and balances. And the other thing that's really important to know about this is that in order for the mouth to open and close symmetrically, these joints have to work on both sides the same way. So if one is gliding a little bit more than the other, or there's a little bit of restriction on one side than the other, then you're going to start to get movement issues. And that becomes apparent when I say to patients, open your mouth, and they open and the jaw goes, it goes all over the place. And that means that there's some imbalances. And most of the time, the imbalances are due to what the muscles are doing on each side of the jaw. Because if this guy here, if he wasn't pinned together, this would fall right off. This doesn't have any complete joint in there, right? So there are things holding it together like ligaments, just like every other joint in the body, but muscles move our joints. And so that muscle issue or imbalance is what's going to create the problems that's going on. And this is actually good news because I can work on those muscles and I can show you some things that you can do as well to help keep your jaw balanced. So it's, we can move our jaw side to side. So, all right, we can open and close. We can protrude and retract. And while I'm doing this, it's clicking and crunching here. So we're gonna work on this together. We're all in it together. We can also do a rotary motion. So, and this is actually one of the unique things that humans can do just because of the way our teeth are in our mouth. So what I want you all to do right now is just take your fingers and either put them right in front of your ear hole right here. You can kind of feel it. Or if you want, even stick your fingers in your ears. I can't hear you, so I'm going to put it right. I can't hear. So I'm going to put my fingers just in front here and open up your mouth and close. And kind of feel what you're doing is your finger is kind of right here because our ear hole is right here. You've got your finger right in front of the ear hole and it should hit this part of the mandible as it's called a condyle, as you're opening and closing. And especially if you stick your fingers in your ears, I can feel that this condyle is hitting my finger way sooner than the other side. So that means that that motion is off. You want to kind of feel if it's equal. Now, you know, this is something you can bring to me, obviously, or your chiropractor if you don't see me. But let's try and see what we can do at home, all right? So there's a couple of different muscles that we need to work on. One of them is called the masseter. And this is one of the major chewing muscles, and it's the one right here on your jaw. So if you put your hands right at your jaw here and clench, you should feel that masseter, okay? The other one is the temporalis. So just like there's the temporal bone right there, it's gonna be right here, and it actually fans out. You can place your hands here. You can open and close. You can clench, and you should feel those muscles engage. The other one is the pterygoid muscles. These are really super tricky because they're actually inside the mouth. And these are the ones that I most often work on that people wish I didn't. So right here, we've got the teeth, and then we've got the jaw in here. Well, right between that space is where those pterygoids are. So this is something you can try and do on yourself. This is something I do in the office. And what you can do is with the same finger on the same side is go right between your teeth and your cheek, and then slide your finger back. And you should feel, probably mine is really taut on the side, a taut fiber there. These pterygoid muscles have different parts to them, which I'm not going to go into, but there is a great big band right there. And you can just put a little pressure on that. And usually when I'm in the office, I put about 4 seconds of pressure. And that could be a short 4 seconds or a long 4 seconds, but it's going to be tender if it's tight. There's no way around that. And it really is important to work on this muscle. So if you can't do it yourself, then have somebody do it for you. Because if these muscles are out of balance, it's going to, if one side is contracting and the other isn't, it's going to swing the jaw over to one side, and that's where you get kind of the zigzag wag of the jaw as it opens. So there's a couple of things you can do for these outer muscles. You can just, along the jawline here, you can just place your fingers and sort of move up towards where your ear is and kind of push. So what we're doing here is we're kind of pushing the jaw this way to try and get it to sit better and to relax some of the muscles. You can kind of hold it here. And this is a good time to do a jaw exercise of opening and closing your mouth. And trying to keep your middle teeth aligned. So you want, when these guys come together, this guy here doesn't have any teeth, but we want to keep that central line aligned. So if your jaw starts to wag around, you want to slow down and try to just hold that pressure and even use your hands to keep it in alignment. So a good way to do this, you've got to look in the mirror. So you cannot just do this walking around, but in a mirror, your bathroom mirror, draw a line with a eyebrow pencil or eyeliner pencil or something like that, or a marker even, because you can wash that right off, and use that as a way to guide as you're opening and closing, if you need that visual, but you definitely want to look in the mirror. You can do a similar thing with your temporalis muscles. So you want to start above your ear and kind of fan your fingers out and push up. And so that's going to release some of the stress here. And again, I sometimes even put my thumbs right where that joint is. And yeah, and try not to let this jut out. So that's a whole nother thing. If you find that you have to glide that bottom jaw forward in order to open, then you're going to want to really hold it back with your fingers so that you don't have to like jut it forward to open. You can also use your hand down here if that happens so that you can sort of push back against it. So these are just kind of some other ways that you can do this. And I will probably just do a separate video and attach it to this so that people don't have to go through all this talking. But this can create problems. When the jaw isn't balanced, it can be a sign that there are also issues with your cranial nerves. So there's a cranial nerve, it's actually the fifth nerve or trigeminal nerve that comes down here and goes to these muscles. So if you have any back of the neck, especially in the upper spine or the back of the head, then that can interfere with the brainstem, which is where this cranial nerve comes from. So this is another aspect of what I do as a chiropractor. We talk about kinetic chains. I have to look at the actual cranium and then all the vertebrae that are in contact with the head, really, the whole head. So that's part of it. If there are any imbalances in the cranium, I can use craniosacral work. And that's where I'm just making sure the cranial bones are moving properly. And I can even do a little release of the jaw. It's a little bit similar here of the pushing up, letting it release, and then I can even draw it down a bit. And then the other part of this cranial nerve issue is that with this connection with the brainstem, there's also a connection with something called the sympathetic nervous system, which is our fight or flight system. So when that gets activated due to things like stress, then we are going to have the jaw clamping down. So we're going to clench our teeth and use those muscles, and that's going to create problems. It could be headaches, it could be migraines, neck pain, jaw pain, teeth pain, sleep disturbances, ear issues, dizziness, throat issues. I mean, we have to look at the whole head and neck. So it's not necessarily, oh, well, it's just my jaw. But there is also this aspect of when you have the imbalances, or if this jaw isn't moving properly on one side compared to the other, then what the brain is going to do in the daytime is it will compensate by how much it moves in the joint, and it may actually move it back a bit because it can't go forward, so that you are not creating more tension in your teeth as they're coming together. They should bite all together. If maybe more pressure is coming on the back, hitting first, then that's going to create more of a problem in the joint, and the body will accommodate. But at night, your brain goes, I don't want to have to deal with that. I don't want to have to accommodate. So it is going to kind of shut down, and as a response, it's going to say, okay, I've got to just splint these muscles and clench them so that my jaw doesn't move and move improperly. Or to release the tension and keep them sort of in a closed position, I'm going to grind them. So this is kind of how it works with the clenching and the grinding. And you might clench during the day too if you are stressed and your brain is occupied with other things. But at nighttime, obviously, it's kind of beyond your control. So this is where we really want to get the jaw balanced, because it can move down the line and create issues. And with your teeth, they can start to erode because of too much pressure. And then that will start to travel down to the gums, and the gums will start to erode. And that creates the periodontal issues, which are related to so many health issues. Really, one day I just have to talk about the teeth, because that's a whole nother thing. But just know that it's not just, oh, I have, a jaw problem. There's so much that goes on that's related to. So when patients come in and I'm doing an exam, I usually look and see if they have jaw deviation, so that I know if that's something that we need to work on. Like I said, I'll do craniosacral work. I may adjust the occiput, which is the back of the head. We may be working on the cervical muscles, adjusting the cervical spine. And then a lot of times I will be working inside the mouth because that's really what's going to help with that imbalance there. So that is basically what I have to say. So I'm going to be working on this myself because I don't like this going on here. And if you've got any issues with your jaw, get it checked out right away by a chiropractor who does work on the jaw, and maybe work with also a holistic dentist. All right, that's it for this Tuesday. I hope you have a great week, and I will see you next time. Bye.